So we come into the issues of data governance, looked at the data ethics. What is data governance? In this case, the data ethics were the principles and values guiding the data lifecycle. And in this case, then it is a process that ensures that data that is collected data is actually secured, it is private, it is usable when needed, searchable, and accurately reliably accessible. Okay, how do we ensure this? By putting in place governance ensures, like, we have to put in place the principles, the procedures, the policies, the frameworks that ensure acceptable and responsible processing of data through data lifecycle stages, including deletion. That is very also important. So data governance therefore helps us to maintain the integrity of the data, the quality of the data, its availability, accessibility, usability, and security, and define the data ownership, and other responsibility related to it. It also ensures that we are compliant with existing data laws or regulations within our different jurisdictions and, of course, the global ones. So it is entrenched in existing regulations and ethical principles, but also included policies and interpretations within specific projects. You will be attached on a specific project. So there are regulations that are governing data management practices. It also begins to adherence with us adhering to the regulations governing the data management practices. And the international data governance encompasses both standards and practices for ensuring that the data that we have is actually fair. Principles of fair, that is findable, accessible, interpretable, and also reusable. And also ensures that the ethical principles, the policies and regulations, recommendations for processing and sharing the data, and the use within and also across the borders. Why do we even have to be concerned about data governance? It enhances decision making, and in its case, decision making based on quality data. Because when you put in place regulations, ensure that we are complying to data collection, obtaining consent, and complying to the existing regulations, then we're able to obtain data that is actually accurate, that is reliable, that can help to make decisions. And then mitigate potential risks and costs with growth in data volumes. We evolving technologies coming in. So it will help us to avoid possible litigations issues should we have our data being mishandled. Improve the quality, we cannot overemphasize that. The efficiency in issues of reducing the duplication and waste created by information silos, and of course, saving the cost for researchers, for funders, for different institutions. Data governance is also very important to facilitate sharing, integration, and exchange of data, because it defines the protocol for us to share. We need to have data sharing agreements. And of course, it enhances collaboration, local collaborations, global collaborations, and whatnot. Data governance measures, such as the requiring data validation, the verification and standardization, will help to prevent errors, mistakes, the inconsistencies, the discrepancies. Thus ensures that the data that we are collecting is actually reliable. And of course, the findings can inform policies and, of course, the interventions in the space. The principles of data governance, briefly, this brings in the human's rights lens and equity to the use of data within and across health systems, including research. And it also informs and strengthens governance models, the regulations, the standards, all the instruments that exist and across countries, within regions, towards a shared vision of equitable health data governance. Another principle, the data governance is a tool that supports the use of digital technologies, the AIs, and data for the health and well-being of all. And therefore, it's a very important critical step towards global framework for health data governance. Principles of data governance, they recognize and they are built on existing norms, on the principle, the treaties and conventions and guidelines that exist, which include, we have World Health Organization data principles. There's a framework for data governance for WHO and their guidance on the ethics and governance for AI, artificial intelligence for health, and of course, Organization for Economic Cooperation and Development recommendation on health data governance, and the Universal Declaration of Human Health. So the principles, I'll mention principles, they're anchored on three broad objectives. They protect, one of the objectives to protect, ensure that you're protecting the health people, protect people, promote health value, and prioritize the equity. So in this case, when you're looking at protecting the individuals and communities against harm and the violations on every stage of data life cycle, what are we talking about? We're just ensuring that there is risk assessment so that we are able to risk assessment in the data life cycle of data collection, data processing, to be able to identify any potential gaps and be able to seal them. And also, then we have issues of participation, so that the issues are actually their needs are also incorporated. Building trust in data systems and practices. And here we have to develop data governance systems in a participatory and a transparent manner. And of course, ensure the accessibility of the regulations that we have, that the data subjects can be able to access, they actually understand, they can be able to know what is happening in a data work. Then it should be very responsive in this case, whereby we're able to respond to the questions being raised by data subjects. Why are we going to use the data for personal information for, and be able to also put mechanism in place to address the existing any possible grievances. Okay. Then ensuring the data security, talked about it, just throughout the data life cycle again, and this should be continuous, and also particularly as we see that there is technology and dynamics, population growth, the need for increased data research and all that for research, and therefore it becomes very important. When we talk about promoting health, enhancing health systems and services, then this should be done in a manner that is actually supporting equity and human rights. And we have different data subjects have different human rights, the dignity and privacy and all that. And then when we are also talk of issues of innovative use of promoting data and sharing interoperability, and also innovative use of the data. So, and when we talk about facilitating the innovative use of health data, then the technology issues also comes in to ensure that the it is key for sustainable development goals. How do we ensure universal health coverage? So that has to be very important. When you are looking at the equity, promoting equitable benefits from the health, have to make sure that ensure that there is equitable representation of all data subjects, regardless of their socioeconomic factors. They have to be able to benefit from the research that you are collecting, and also include them through public engagement and include other stakeholders in this particular place. And then establish data ownership, data rights and ownership, so that we're able to protect them and ensure the safety. And also their right also to benefit equitably is also important, and include productive and includes the productiveness and services from the different data. So their rights, they have to know, they have to understand, and they have to benefit and also be able to control what happens to their data. Okay. So we look at the data ethics and governance, the linkages between data ethics and governance briefly. So data ethics provides the foundation for defining what is right or wrong in using data, that is confidentiality, while on the other hand, the governance will help us to provide a framework for implementing those particular ethical principles in practice, the policies, the audits, through policies, established policies, audits, and access control. Data ethics informs the design of data governance policies and standards. And in this case, for example, if we need privacy for data subject, may lead to policies that ensure the same, while data governance, of course, ensures compliance with ethical norms. The other examples are related to data ownership. Data ethics will require that individuals have ownership over their personal information, but then governance ensures that we have frameworks for obtaining the consent from data subjects before data use or collection. The quality, we require complete, accurate, relevant, and timely and consistent, then establishes way for ensuring measures that actually ensures that we have data quality. Data security, again, individuals have a right to privacy, set up measures that ensure the privacy is actually assured. Okay. Then finally, on data transparency, data ethics will require that we have data practices that are clear, accountable, and auditable. And what will data governance do? Ensure that we have mechanisms for documenting, reporting, and reviewing data activities.